Asepsis in urethral examination. However infected the bladder into which a catheter or sound is to enter, that catheter must be scrupulously aseptic. The days when surgeons may joke about the old gentleman who keeps his catheter inside his hat and spits on it by way of lubrication are past. Footnote. Yet such old gentlemen are still encountered in practice, but the apparent immunity which some of them enjoy is due in part to the fact that their bladders are already so severely infected that a little saliva makes them no worse. And though their immunity may for a time prevail, in the end they become more and more infected and die of sepsis. The need for scrupulous asepsis is not because every dirty catheterism causes infection, but because a single dirty catheterism may cause infection of the gravest sort. Even when the bladder is infected, asepsis is imperative to prevent an increase of that infection. The asepsis of catheterism, using the term broadly to cover every passage of an instrument into the urethra, implies 3 requirements, viz. 1. Asepsis of the physician's hands. 2. Antisepsis of the patient's urethra. 3. Asepsis of the instrument introduced. Asepsis of the physician's hands. It is not possible to require of the physician about to pass a catheter that he sterilize his hands as if for a surgical operation or wear sterile rubber gloves. Such cleanliness is only required for such prolonged and delicate operations as cystoscopy. But the physician's hands should be well washed with soap and water, and, having washed his hands, the physician should act as though they were still dirty, i.e., he should not touch that part of the instrument that is to enter the deep urethra. This is a simple rule, a necessary rule, a universal rule. The last 3 inches of the instrument should not be touched by anything except sterilized lubricant from the time it is sterilized until it enters the urethra.